Hi, Dr. Alex Perry here from the Blue Sky Chinese Medicine Clinic. In this next webisode, I want to talk about something that's quite important, but perhaps not well understood in Chinese medicine, and that is tongue diagnosis. Now, Chinese medicine grew in a time when we didn't understand a great deal about science or the way that the body functions as we do now. So it really was an observational medicine, and when the earliest records of Chinese medicine were found up to 5,000 years ago, we found a great deal of clinical observation for the body, both in health and in illness. And even today, even though we look at blood tests and pathology reports and x-rays and ultrasounds and so on, being able to observe the body is still a really critical part of forming a diagnosis. And tongue diagnosis is an important part of that, because you can read a lot from the tongue, interestingly enough. So, tongue diagnosis. What are we looking for and why? Well, the tongue to me is a really interesting organ, because it's really it's probably the only organ that has a direct connection between inside and outside. So it's part of that GI tract, and it really does have a very strong nerve supply, obviously, for taste, and also a very strong blood supply, which is why your tongue is so red. And what does happen is it connects directly to your stomach, so you get a bit of an idea from a digestive perspective what's happening in the body. But more generally, because of the colour, the shape, the coating that the tongue tends to have, then it can give us some really important clues as to what's happening in your body. Now, there are schools of thought that talk about, for example, pulse diagnosis as being the main way of determining what's happening in the body, or tongue diagnosis, or a whole range of things. In fact, the way that I was certainly trained, and I believe is most important, is that we look at all the factors. So we use observation, we use palpation, and we use questioning. So questioning obviously is talking to a patient during a consultation. Observation is, well, looking at the patient, colour of the skin, the hair, the sparkle in the eyes, a whole range of things, including looking at the tongue. And then palpation is just is touch, really. So feeling the pulse is the main way, but there are other ways of palpation. There are abdominal palpation, a whole range of things, and certainly with injuries and pain and those sorts of things, you want to get a sense of where the pain location is. But in terms of observation, tongue is really interesting, and the tongue can change depending on what's happening, particularly in your gut. So the sort of things that we're looking at really is what's happening to the body of the tongue. So if we think about the body, we're looking at, first of all, the shape. And the shape should be, well, a pretty typical tongue shape, but you'd be surprised how often or how regularly we see a different shaped tongue. And by shape, we're really talking about the size of the tongue and some of the indents that can happen in it. So what happens is, in some conditions, you can actually get what they describe as a scalloping of tongue. So instead of having a nice, round, even edge, you get what we describe as a scallop, which looks more like, I'll do it on this one, you get these kind of scalloped effects. And that tends to happen when the tongue gets a little bit swollen, it pushes against the teeth, which is why you get that scalloping. And that's indicative of a range of conditions. Other things that can happen to the body itself can become split or cracked, and that's really important. Sometimes you can have a central crack, you can have cracks around the edges. You even see from time to time what I describe as a laddering crack, where you get a central crack and then a whole bunch of cracks down the centre. And that often goes along with other things that we're looking at. For example, the colour of the tongue. And a tongue typically should be a nice, vibrant, pinky red colour. So we look for changes in that. So we look for a tongue that is paler than we would expect. We look for a tongue that is darker than we would expect. And we look for discoloration on the tongue. Dark spots, purple spots. Any change in colour can be important. Not just on the tongue surface itself, but even underneath the tongue is often somewhere where your practitioner will look. Not always, but sometimes. And the colour gives us an idea of what's happening. So for example, in a tongue that is cracked, then often that colour will be quite a deep or a bright red colour, because it indicates that there's heat in the body and you're getting some damage to the body fluids generally. So that's one thing to look at. The third thing that we look at is the coating on the tongue. And a coat traditionally that was normal was described as a thin white coat. So if we get rid of the diseased tongue for a second, we're looking at a coat that has a nice even spread over the tongue body itself. So that's what a normal coat is. Now coating can change. Now we used that example of heat where the tongue was cracked, dry. So what we're looking for now in a really hot tongue is where that coat actually, well, it can change in a couple of ways. It can become quite yellow. It can become, or it can disappear altogether. So you can have no tongue whatsoever. No tongue coat. Most people still have a tongue, but that coating can certainly disappear. So these things are really important. The tongue coat could go the other way. It might not be yellow, but it might be white. It could get very thick and greasy. Someone, for example, with a candida infection or a yeast infection can have a white coat on their tongue or around their mouth. So that coating is really important. All of this information together gives us a good indication of what's happening in the body. And what we're always trying to do when we're finding information about your health is to find as many signs in your body that are going to support our diagnosis. And sometimes you find that the tongue supports the direction you're going with the diagnosis, and sometimes you don't. There are always anomalies in these things, but wherever possible we try and use as many like factors as possible to help differentiate when it comes to diagnosis. So I hope that gives a bit of information about why we look at a tongue. Certainly for most patients, when their Chinese medicine practitioner asks them to stick their tongue out for the first time, can be a little bit strange, but it's an important part of that observational side of Chinese medicine. A point that is worth making, I often find patients who scrape their tongue regularly, so they have no tongue coat. Now, it's hard to really determine why that's happened. I think it's because, at least partly because toothbrush manufacturers have decided that having a brush on one side of the tongue, on one side of the brush, is a good thing to sell more brushes. I'm not sure. To me, there's no real reason to get rid of that coating on your tongue. And certainly from a diagnostic perspective, if you take that coating off, then that's one aspect of those three that we can't observe. So I don't think there's any real reason to remove the coating on your tongue. There are some conditions of the tongue itself, the tongue and the mouth, gingivitis among other things, but for the most part I would leave the coat on the tongue. I don't think it's necessary to brush it off, and certainly I'd be interested in seeing what that coating looked like. So I hope that gives you a little bit of information about tongue diagnosis, and I look forward to seeing you on the next webisode.